You know that calcium supplement you might be taking, thinking it's just straightforwardly good for your bones.
Yeah, the common wisdom.
Well, for a lot of people, it could actually be a detour with some pretty unexpected risks. We're talking potentially contributing to clogged arteries.
It's true. And these supplements are incredibly common, so this is really important stuff to understand.
Absolutely. The idea that, more of a good thing is always better. It's powerful, especially with nutrients.
But with calcium, it's just more complex than those simple marketing messages suggest.
Exactly. So, in this deep dive, our mission is pretty clear. We want to figure out when taking calcium pills is actually, a smart move.
And when it might not just be ineffective, but potentially harmful.
Right. And also give you some practical ways to minimize risks if supplementation is something you or your doctor are considering.
Okay, so let's start with the basics. Calcium. It's an essential macromineral. Our bodies need quite a bit of it.
And it does some really fundamental jobs, right?
Totally. Building strong bones, bone mineralization, but also muscle contraction, setting nerve signals, even blood clotting. Really key stuff.
And the general target is, what, about a gram a day for most adults.
Around that, yes. And here's something that might surprise you.
Yeah.
For most people, eating a reasonably varied diet, hitting that gram mark, it's usually quite achievable just through food.
So you don't necessarily need a pill.
Often not. Yet we're constantly bombarded with marketing, aren't we? Pushing calcium supplements for, well, everything, preventing osteoporosis,
Making up for not eating dairy.
even mistakenly for preventing muscle cramps, which isn't really accurate.
Yeah, those messages have created a lot of misunderstandings.
Which really brings us to the core question we need to unpack here. What is the key difference between getting calcium from, say, food versus swallowing a concentrated pill?
That feels like the heart of it.
It really is. And when we talk about the potential downsides of supplements, the big concept to grasp is ectopic calcification.
Ectopic, meaning in the wrong place.
Exactly. Calcium building up where it shouldn't be, like in soft tissues, and critically in the walls of our arteries.
Okay, calcium in arteries sounds definitely not good.
It's really not. These calcium deposits directly contribute to forming plaque, what doctors call atheroma.
And plaque is what narrows the arteries.
Precisely. It hardens and narrows them, and that significantly increases the risk of a heart attack, a myocardial infarction.
Which is still the leading cause of death in the West, right?
Huge issue.
A massive issue. And it's a sobering thought, but about half of all heart attack victims don't even make it to the hospital alive.
Wow. That really puts the stakes into perspective. So, okay, what's the research actually showing about this link?
Yeah.
Supplements and heart problems.
Well, recent clinical studies, and especially meta-analyses, those big reviews combining data from lots of studies, they've pointed to the moderate but, noticeable increase in cardiovascular event risk with calcium supplementation.
A moderate but noticeable risk. Yeah. And like we hinted at, the main difference seems to be how our body handles calcium from pills versus from food.
Okay, let's dig into that. What makes a pill different from, I don't know, a tin of sardines or some spinach?
Good question. When you take a big dose of calcium all at once in a supplement,
Like 500 milligrams or 1,000 milligrams?
right, it causes this really rapid, sharp spike in your blood calcium levels. Doctors call it hypercalcemia.
Okay, a sudden spike.
But that sudden spike, it doesn't typically happen when you get your calcium from food, whether it's sardines, spinach, dairy, whatever. The absorption is more gradual.
Ah, so it's the speed of absorption.
It seems to be a major factor. This abrupt surge in blood calcium appears linked over time to more calcium getting deposited in artery walls.
Which, as you said, raises cardiovascular risk.
Exactly. It's not just the total amount, but maybe the concentration and the speed it hits your system. Think of it like a sudden downpour versus a gentle rain.
Right, the downpour causes flooding.
Precisely. And there's some compelling research here. A study in the British Medical Journal, the BMJ, a few years back. It showed that taking calcium supplements without also taking vitamin D was linked to a higher risk of heart attack.
Without vitamin D specifically.
Yes, that detail seems important. They found a 31% increased risk over about 3.5 years in the calcium-only supplement group compared to non-users.
31%. That sounds pretty significant, especially given how many people pop these pills.
It really is.
Yeah.
And then there was a big study using a South Korean database looking at over 11,000 osteoporosis patients.
Okay.
They found that people taking calcium, again without vitamin D, had a startling 54% increased risk of a non-fatal heart attack compared to those who didn't supplement at all.
Wow, 54%. That's a big jump.
It definitely grabs your attention. And then there's the MESA study, the multi-ethnic study of atherosclerosis.
Right, I've heard of that one. Followed people for a long time.
Over 10 years, yeah. Very diverse group. And it gave some really interesting insights. They found people with higher dietary calcium intake, over about 1,450 milligrams a day.
So getting a lot from food.
Right. They actually had lower coronary artery calcium scores, the ski score. It measures calcium buildup in the heart's arteries. Lower is better.
So food-based calcium seemed protective in that study.
Exactly, which really reinforces that food-first idea. But here's the kicker. The MESA study also found that taking calcium supplements was associated with a higher CAC score, more calcification.
Oh, interesting. So supplements had the opposite effect.
It appeared so, yeah.
Yeah.
Especially in people who weren't getting much calcium from their diet otherwise. And guess who had the lowest risk overall?
Let me guess. People eating lots of calcium-rich foods and not taking supplements.
Bingo. High total calcium, mostly from diet, no supplements. That was the sweet spot for the lowest risk in that study.
That's a really crucial distinction. So why? Why would food calcium be okay, even good, while supplement calcium might be problematic?
Well, the leading theory is about the food matrix. When you get calcium from food, it comes packaged with other important nutrients.
Like minerals, vitamins.
Exactly. It's in the right sort of amounts within this complex structure, along with cofactors that probably help your body absorb and use it properly. Nature's packaging, if you like.
That makes a lot of sense. It's rarely just about one single nutrient working in isolation, is it?
Almost never. And they've even used techniques like intravascular ultrasound IVUS to look inside coronary arteries.
Seeing the plaque directly.
Yeah. And those studies have shown more calcium deposits in the arteries of people taking supplements compared to non-supplementers.
So you can actually see the difference.
You can see more calcium. Now, these particular studies, running maybe 1.5 to 2 years, didn't always show a definitive change in the total plaque volume, but seeing more calcium deposition itself is definitely a worrying sign.
Okay, so the evidence seems to lean pretty strongly against just, casually taking calcium pills for general health.
For the general population without specific needs, yes.
But you did mention earlier there are times when supplementation is justified, even beneficial.
Absolutely. It was vital we cover that too. Calcium is essential, and for some groups, supplements are important.
So who falls into that category?
Okay, first, older adults, especially those in nursing homes or similar settings, supplementation might help reduce their fracture risk.
Makes sense. Fracture risk is higher then.
It is. But interestingly, even in that group, one study showed that just increasing dietary calcium and protein intake,
Just through food.
reduced fractures by a whopping 33% and even cut falls by 11%. So diet is still powerful, even there.
Wow, 33% just from food. That's impressive. Okay.
Second, anyone diagnosed with osteoporosis, usually based on a bone density scan.
Okay.
For them, calcium is often recommended, but crucially, almost always with vitamin D to help absorption.
Right, we heard that vitamin D link before.
Exactly. Third, postmenopausal women who are at high risk of fracture and aren't getting enough calcium from their diet, say below 700 milligrams a day. Supplementation might be considered.
So again, it's about specific risk factors, not just being postmenopausal.
Precisely. It's targeted. Another group, people on long-term corticosteroid treatment.
Like prednisone.
Yes. If you're taking the equivalent of more than 5 milligrams of prednisone daily for over 3 months, those drugs can really thin your bones.
No.
So calcium, likely with vitamin D, is often advised after talking with a doctor.
Okay, that makes sense because of the drug's side effects. Any others?
Yeah, there was an interesting study suggesting that vegan women over 45 might have a higher risk of hip fracture if they aren't supplementing with both calcium and vitamin D.
So a specific dietary pattern plus age and gender.
Seems so.
Yeah.
And finally, there are clear medical situations involving hypocalcemia, clinically low blood calcium.
Where levels are actually measured as low.
Right. Often comes with symptoms like muscle twitching or cramps. Could be due to issues like hypoparathyroidism, severe vitamin D deficiency, or problems absorbing nutrients. In those cases, supplementation isn't just optional, it's medically necessary.
Got it. So it really boils down to specific risk groups, diagnosed conditions, or medically confirmed deficiencies. Not for everyone, just in case.
That's the key message. And even for those who do need to supplement or just want to support bone health optimally through diet.
There are ways to do it more safely.
Yes, definitely strategies to minimize those potential risks we talked about.
Okay, let's get into those solutions. What are the main things people should focus on?
Number one, absolutely hammer this home. Prioritize getting calcium from your diet whenever possible, unless you're clearly in one of those justified groups we just outlined.
Food first.
Food first. Think beyond just dairy, too. Almonds, leafy greens like kale and broccoli, those calcium-packed sardines we mentioned. Fermented dairy like yogurt and kefir are great, too. Aim for variety.
Diversify your calcium sources. Good tip. What's
Sure.
next after focusing on diet?
Remember that calcium doesn't work alone. It needs friends, cofactors to be used properly. And the most critical one is vitamin D,
We keep coming back to vitamin D.
because it's essential. It controls how efficiently you absorb calcium from your gut. If your levels are low, say below 30 nanograms per deciliter, which is a common benchmark, your calcium absorption efficiency can plummet to less than 15%. That inefficiency might actually contribute to those erratic blood calcium spikes we want to avoid.
Ah, so low D means poor, maybe spiky absorption?
That seems to be part of it. It likely explains why the heart risks popped up mainly in studies where people took calcium without vitamin D. Adequate D leads to smoother, more sustained calcium absorption.
So rule number one, if supplementing, make sure your vitamin D is sorted.
Absolutely crucial. Get your levels checked if you're unsure.
Okay, vitamin D is step one. What else helps manage calcium safely?
Vitamin K2. This is another really key player. Think of it like this. Vitamin D gets calcium into the body.
And K2 tells it where to go.
Pretty much. Vitamin K2 helps direct that calcium towards your bones and teeth, where you need it, and importantly, away from soft tissues like artery walls.
How does it do that?
It activates specific proteins. One called osteocalcin helps lock calcium into the bone matrix. Another, called matrix glob protein, or MGP, actively works to inhibit calcium from depositing in blood vessels.
Wow, so K2 is like the traffic cop for calcium.
That's a great analogy. Its different forms, like MK7 and MK4, are vital for this process.
Okay, where do we get vitamin K2 from? Is it common?
Good sources include natto, that fermented soybean dish, which is super rich in MK7.
Right, natto?
Also, certain aged and fermented cheeses. Think Gouda, Brie, Edam, Roquefort. They tend to have more MK4.
Cheese. Good news for some.
Definitely. Egg yolks are another source, as are whole, full-fat fermented dairy products like kefir. Grass-fed sources tend to be higher, too.
Got it. So vitamin D for absorption, K2 for direction. Is there a third musketeer?
There is magnesium. Magnesium is vital. It acts as a cofactor for vitamin D metabolism, meaning vitamin D can't work properly without enough magnesium.
So they work together.
They do. Plus, magnesium itself seems to help inhibit the formation of calcium crystals or salts in places they shouldn't be, like blood vessels. It helps keep calcium soluble.
Okay, so magnesium supports vitamin D and directly helps prevent unwanted calcification.
Exactly. It's all about this synergy between these key nutrients: calcium, vitamin D, vitamin K2, and magnesium.
It really is a team effort inside the body, isn't it?
It absolutely is. It's this delicate, crucial balance, not just about flooding the system with one thing.
So let's try and wrap this up. If you had to give one main takeaway message from this deep dive, what would it be?
The primary message is this. For most people, unless you're in a specific high-risk group or have a diagnosed deficiency,
Yeah.
focus on getting your calcium from a balanced, whole food diet. Don't just reach for an isolated calcium supplement. Food gives you calcium in context with the other nutrients needed to handle it properly.
Because taking those high-dose calcium supplements, especially on their own, long-term,
Could potentially bump up your risk of coronary events, heart attacks, strokes by maybe 20 to 30% based on some of that data.
that's not insignificant. It's a risk worth taking seriously.
Definitely.
And the key to minimizing that risk, whether calcium comes from food or, if necessary, supplements,
Lies in ensuring you also have adequate vitamin D, magnesium, and especially vitamin K2. These work together like a team to put calcium where it belongs in your bones and keep it out of your arteries.
this has been so informative. It really highlights how we need to think beyond just single nutrients, doesn't it? Look at the bigger picture.
The whole dietary pattern, the synergy, that's key.
So maybe a final thought for you, the listener, to take away from this. Take a moment to consider the balance of micronutrients in your own diet. Are you getting enough of not just calcium, but also vitamin D, K2, and magnesium from the foods you eat? Thinking about that balance could be really valuable for your long-term health.